Are you taking any medication for your autism? Today, we're going to talk about medication for autism. What works and how does it work? So, today, um, we are talking about Abilify, Strattera, Bumex, Risperdal, Luvox, Pitocin, which is oxytocin, and Risperdal. So there was a study done about a whole bunch of different studies done about what are the most effective um, medications for autism. So what they found is that um, when they studied, they didn't really look into a lot of um, dietary supplements, but they were looking more into medications. So Prozac is it's called fluoxetine. It's a selective serotonin reuptake inhibitor, which sometimes is used to treat specific symptoms associated with autism, such as anxiety and depression. However, it is not approved for the use for for autism. So, what some doctors and pharmacists do is they do what's called off-label, um, because a doctor can prescribe just about everything for anything. But at the same time, they have to prove that it's safe and effective in order not to get sued for malpractice. So Prozac's a medication that's been around for a long, long time. Some people don't get the results from Prozac, but then some people do. So, but anxiety and depression, it may help. Um, so, just like with any other medication, common side effects that some people may experience for taking Prozac includes feeling sick to their stomach because the raising of the serotonin in the stomach can give you a stomach ache. Trouble sleeping because if you have too much serotonin, you can be anxious at night, especially, so it'll make you harder to sleep. There are some people that are experience autism and actually have too high a level of serotonin. So this would probably not be the best option for those type of people. Um, so also, I'm not really sure why, but some people can feel more tired than usual, and also they can get a headache and feel a little bit dizzy. Abilify. So Abilify is a medication that is normally given out for schizophrenia and bipolar, and is what's called an atypical antipsychotic medication that sometimes is used for the treatment of the symptoms of autism, such as irritability, aggression, and self injury. So it's working. It says the thought is to work by modulating the levels of certain neurotransmitters in the brain, such as dopamine and serotonin. Um, Abilify usually is prescribed in a combination with other medications and or interventions such as behavioral therapy, and it is should only be used by a qualified, you know, you need to be under the care of a qualified healthcare professional. Um, so, some of the common side effects that some people may experience include feeling sleepy or tired, dizzy, having a headache, and feeling a bit sick to the stomach. You also may feel a bit restless and have trouble sleeping. So, Abilify can have the same kind of side effects as Prozac. So, Strat Strattera, Strattera is a medication to treat ADHD Some people who have autism also have ADHD. And so it might be effective in reducing symptoms. Um, the exact mechanism is not well understood yet. Still, it's thought to be related to the ability to increase certain uh, neurotransmitters, such as norepinephrine. So that's giving you more energy. So if somebody is down and having problems getting motivated, it could help with motivation, and also increasing dopamine. And dopamine is a habit building neurotransmitter. So it's thought in regulating attention, impulsivity, and social behavior. However, it is important to note that it's not FDA approved for the treatment of autism, and more research is needed. So, common side effects, some people may be experiencing feeling a bit of a stomach ache, having trouble sleeping, having a headache, feeling more nervous or anxious than usual, and feeling dizzy. So, if you're naturally anxious, this might not be a medication that would be best for you. Talk to your doctor to find out what you can, if you're experiencing side effects that are making you more anxious, that's not a good thing. Risperdal is a medication to treat schizophrenia and bipolar. Risperidone is another antipsychotic medication, and helps with treating irritability, aggression, and self-injury. Um, yeah, and so it's similar in what it's some of the other medications as well. Um, so, um, so it's also not FDA approved for the treatment of autism. So it's considered off-label. Um, so common side effects include weight gain, drowsiness, increased appetite, and constipation. Other possible side effects include difficulty sleeping, headaches, and changes in blood pressure or heart rate. Some patients also experience tardive dyskinesia. I can't even pronounce that. A condition characterizing by involuntary movements of the face, tongue, or extremities. So, tics. So, if you are, you got to be real careful with this one, because we already have problems with dealing with social inadequacies, and have problems making friends. So if you are taking this medication and all of a sudden you're having tics, like something like that, that's not going to be good. Um, that may harm you. I'm not a doctor. I'm just putting out my personal experiences of what I want out of any help, and that's definitely not what I would want. But some people it's going to work for, and they're not going to get side effects. So there's another medication called what is it? Bumex, and Bumex is a diuretic drug that's sometimes a treatment for autism. The drug is believed to reduce the levels of GABA in the brain, which may help improve social behaviors and reduce repetitive behaviors in individuals with autism. However, there's limited research and this drug as a treatment for autism. So more studies are needed. Common side effects that some people may experience with butamine include feeling dizzy, lightheaded, sick to their stomach, having trouble sleeping. You may also experience diarrhea, constipation, stomach cramps, and muscle cramps. So you got to be careful with these medications. Sometimes they may work. So one of the things with autism is there's many different um, things going on. Myself, I have low amounts of GABA and high amounts of norepinephrine and epinephrine, so adrenaline. So, I'm naturally neurotic, and and even though my outside is relaxed, my inside is totally hopelessly neurotic. So I'm always nervous, especially in new situations, social situations as well. Um, that's why I used to abuse alcohol back in the day, because alcohol produces GABA, and that helped me until it didn't, until it started ruining my life. So I stopped with the alcohol. So, um, so a lot of these medications, they have side effects. They also, depending on what your effects are from autism, you have to look into the characteristics of what you're trying to do with a medication. So you want to do research, then you want to talk to your doctor, let your doctor know what you're looking for from a medication, what you hope to accomplish with it, what are your goals, what are your risks. Ask the doctor. Sometimes they'll just write you a script and insist that you take a drug, and other doctors are not into uh, handing out drugs like Skittles. So talk to your doctor, educate yourself, and I hope this is helpful. So with that, this was Finding Your Hidden Superpower: Autism, Asperger's, and those of us who are neurodiverse. Um, and please click like, subscribe, and thank you. I hope this was helpful.